Good evening. My name's Ben Warner, and I'm the Chief Nursing Officer at Henrico Doctors Hospital. And on behalf of the administration, the hospital, and medical staff of Henrico Doctors Hospital, I welcome you to the first annual RVA Birth Community Celebration. It's a little history. A year ago, our leadership team sat down and we had to strategize, how are we going to grow a program that is already the largest maternal health program in Central Virginia? Well, we quickly concluded that we needed to develop a birthing service that ensured every childbearing woman in the Richmond area could safely choose the birthing experience she desires. So to achieve that goal, we also determined we needed to find the right leader to take us there. So we conducted a nationwide search, and we were very, very fortunate to find that person in our own backyard, Amber Price. I'm very proud to say she's a member of our leadership team. She's the Vice President for Women's Services at Henrico Doctors Hospital. And as you can imagine, she's already made a profound impact on the quality and the breadth of services at our hospital. Most notably, she is helping us grow our lower intervention birth services. But I want to share a couple other thoughts with you on a personal note. She's also helped me understand and appreciate some of the finer aspects of the birthing experience. Not being a birthing mother, I have to learn this from others. So, for instance, she helped me and others select the right size and style bathtub for laboring mothers, something we didn't know a lot about. We also learned the value of king-size beds for postpartum mothers. Even better, we learned that some laboring mothers don't even need a bed. But most importantly to me, we were able to find the right kind of extra virgin olive oil to assist those laboring mothers during the birthing process. On a serious note, it's my distinct pleasure and honor to introduce to you Amber Price, Vice President of Women's Services at Henrico Doctors Hospital.
All right, can everybody hear us okay? Show of hands. All right. All right, all right. Okay. So I have to read this because I'm very emotional tonight. So Henrico Doctors Hospital is very honored to host all of you. I am very happy to see you're all dressed up because on a birth post this morning, somebody said that cocktail attire meant wearing your nice Birkenstock. So thank you for kicking it up a notch. That's awesome. I appreciate it. So we're happy to host the Richmond Birth Culture. It's a culture. We all are here together from very varying backgrounds and different ideas about what birth is traditionally. And Richmond has a very rich birth culture. And we're very fortunate that we have many resources and birth options in our community. But in this room, I see certified nurse midwives. I see home birth midwives. I see people who work in birth centers, obstetricians, acupuncturists, nutrition experts, medical workers, nurses, patients, women who are just curious about what we're doing, and a whole host of other people who are just interested in what is happening in birth in our city. I'd like to welcome our guest speakers tonight. A warm round of applause for Ginger Breedlove. All right. Whitney Pinger and Dr. Bathgate, who are featured in Mama Sherpas. And of course, our two major guests, Ricki Lake and Abby Epstein. Thank you. We appreciate it. Earlier this evening, Ricki and Abby came to the hospital and met with our patients, held babies, and met with our nurses who couldn't be here tonight because this event was sold out in 48 hours. Yeah, awesome. So, Ricki Lake and Abby are here because their work brought the discussion about collaborative practice and birth choices to the national spotlight. They made certified nurse midwifery a household name. Pregnant women in this country now know that this is an option for them, in part to the work that they've done. And that's an important thing. We're pleased to host everybody here at Quirk Hotel. Round of applause for Quirk and the food. Thank you. Very nice. And enjoy the bar and the drinks, of course. So we wouldn't be here tonight without the support of our sponsors and vendors. take some time to walk around their tables and learn what they're doing and what they offer to the Richmond birth community, and it's quite a lot. And I'd particularly like to thank our 2 platinum sponsors, Iris Co. and Keith Bell, of course, with Oriental Medicine Specialist. All right. So I'm going to tell you how all this happened. Ben touched on it a little bit, but in August we started talking about how do you get everybody around the table and how do you really get a collaborative system going. And in addition to the private midwifery practice that is already here, that has privileges at Henrico Doctors Hospital, West End Midwifery, who are right over here if you want to go check them out. Yes, Catherine Beaton, Rebecca Franco, they're here tonight. We felt that the greatest access to a full range of care for our patients and our physicians would be achieved by adding certified nurse midwives to our hospitalist service, so that all women would have access to both midwifery care and physician care 24 hours a day. And evidence has shown us that when you put a hospitalist in a hospital, you drop cesarean rates, you drop preterm birth rates, and you drop complications. And it's because there's always somebody there who can handle problems that come up. And usually hospitalists are people who enjoy just being with women in labor, so they're experts in what they do. But midwives added to that mix add another skill set, and that skill set positively affects exclusive breastfeeding rates, and it really affects induction rates and cesarean rates even further. So what we did is develop a model that puts a midwife and a physician together in labor and delivery as a collaborative team around the clock. So we listened to our patients, we listened to our physicians, and we developed a proposal. And we listened to the presentations from various companies to see how they would do that. What does that look like? If I gave this to you, what would you do? If I gave this to you, what would you do? Tell us what it would cost. Tell us how many midwives you would have. Tell us how this works. And in that process, we learned a lot. We learned about what wouldn't work. We learned about what would work. And then we developed a program and a system that we felt would work. And after a lot of time and listening to a lot of people, we're pleased to say that in the end, the contract was awarded just this month to OHI, which is the OB Hospitalist Incorporated Group, which is our existed and beloved hospital group. Thank you. Very excited about that. So the result is that any patient who's receiving prenatal care in any practice that has an agreement with this group, OHI, can now request a midwife for delivery. Any patient at Henrico Doctors Hospital can now say to her physician, I would like a midwife, and that option is now available to her. We have an opportunity to meet and connect with midwives during pregnancy. How that's going to work, we don't quite know yet, but we know that they'll have access to their midwives for the key components that midwives provide, which is connecting, which is understanding, which is developing the birth, and getting an understanding of what that woman is looking for in her birth. And in addition, we recognize that preparation for a midwife-attended birth is unique. And women who are seeking midwifery care have a different need in their preparation. And so we're very pleased to say that we partnered with MyBirth. We partnered with MyBirth. And over many months, we developed a contract with the ladies of MyBirth who are here tonight, who will develop unique educational materials for our low intervention classes, but will also develop the unique materials for midwifery preparation. And so they are in-house to help us understand what we all need to do to get these women feeling like they're still getting the preparation and the care that they need during their pregnancy. So OHI has always been known for a very high standard in the hiring of their physicians, and we're very confident to see this continue with the certified nurse midwives that they'll bring on board. They recently announced that they hired Megan Batten, CNM, as Director of Midwifery Services. And over the next few months, the hospitalist midwife team will grow to have 5 employees who will work as a collaborative team alongside the OHI physicians at Henrico Doctors Hospital. But opening up us to midwifery care and opening it to any woman seeking it as an intrapartum option without a contract limiting her options and without a need to find a specific prenatal care provider is both innovative and it is inclusive. And in the past, women were expected to break the relationship with an obstetrician that they really liked in order to receive midwifery care, and that caused anxiety for both parties. By meeting the needs of every woman seeking to have her baby in our facility, be it with a midwife or via traditional care with an obstetrician, we've truly redefined collaborative and inclusive practice, and we've opened the door to frank communication about birth wishes and about accommodating those wishes without judgment, within a culture of safety, collaboration, and a standard of excellence that has always existed at Henrico Doctors Hospital. I'm very proud to have been a part of the birth of this new model and to be able to bring it to RVA. But mostly, I'm honored to have made so many friends over the past few months. Respectful maternity care is alive and well at Henrico Doctors Hospital. That's right. I have encountered compassionate and kind physicians who have worked alongside me to make this possible, and I am proud to work alongside this outstanding team of professionals. We would not be here today without their input, their support for this model, their understanding of the needs of their patients, or their expertise. I'd also like to thank our CEO, Will Wagner, who could not be here tonight, but who drove this vision, and my partners in the administrative team, who've had to adjust to olive oil policies and birth stories in the boardroom. Thank you for welcoming me so warmly and for welcoming midwifery to Henrico Doctors Hospital. Thank you. I would now like to call to the stage Dr. Elizabeth Roberts, who's the chair of obstetrics and gynecology at Henrico Doctors Hospital. Thank you.
Hello. I want to make sure I'm speaking so everyone can hear me because I have a soft voice. Can you hear me? Anyone? Wendy says bring it up a notch, so I will. Okay. Maybe just be Wendy. So I'm the chairperson for the Department of Obstetrics and Gynecology at Henrico Doctors Hospital, which means that I am chosen by, I don't know if chosen is the right word, chosen by the administration, voted in by my colleagues to represent the physicians. Thank you. So I express their concerns, I address problems and other issues as they relate to patient care that we give to reproductive age women at Henrico Doctors Hospital. It's important for everyone to realize that the physicians are trained in something called allopathic medicine. Does anyone know? Raise your hand if you know what allopathic medicine is. So we are all trained in this is a term that's applied to the present prevailing system of medicine. And its definition is the curing of a diseased action by the inducing of another different action. So it's important to realize that all of us are trained within the framework of the start of disease. That is our training. As a result of this, physicians have often been considered someone who should be avoided in delivery at all costs. And I reject that opinion. I have an interest in historical medicine, and history, I think, informs our current approach to medicine as well as many other aspects of our lives. And I have had the opportunity to create some talks regarding the history of obstetrics and childbirth. And there are several things that have become very evident to me. One is that there are several things that we should keep. And the second is that there are several things we should not keep. One thing that we should keep is the concept of a midwife. It's a very historically strong figure. It's a medicine woman It's a woman that had specific training, whether it was spiritual or herbal, but it was within their community, and they helped women through childbirth. And they had a specific set of skills. They worked with their community and the family to create what's called social childbirth. And that is a large part of what people are looking for when they are having children. Another thing that we should keep are the options that we give to women by giving them the availability of more interventional medical care, because there is no more option-less situation than delivering a baby in a tent with a dirt floor when there is no option for helping with that delivery if there is a problem. So the real approach to giving options to women is to be able to give both to them. There are certainly elements that we should not keep. The extremes of medicalization of childbirth. One of the very famous examples are scopolamine and restraints of women. We should not keep that, and we have not kept that. And the other thing that we should not keep is the animosity, excuse me, the animosity or the us versus them mentality that often has developed between midwifery care and allopathic medicine, beginning, I propose, as a reaction to that medicalization that happened in the 30s through the 50s in this country and others. So my idea, and I hope that all of my colleagues will join me, as well as the others that are joining into the care of women during childbirth at Henrico Doctors, that we will have a collaborative and a cooperative practice that helps women to understand what is normal and natural, and help them understand disease and abnormality and when they need intervention that is different, and to use all of our medical professionals to their strengths. Everybody needs to be able to use their training as it's meant to be used. Those are my words. Thank you.
Thank you, Dr. Roberts. Very nicely said. I would like to call our platinum sponsor, Katie Coleman, to the stage. Katie, I know you're hiding. So Katie is the owner of Iris Co. And if you've ever had a baby with a doula or a midwife in Richmond, you were likely comforted and energized by her wonderful oils. I love walking into a birth space and being surrounded by her signature scents. They work on midwives too. I'm the proud owner of 2 Katie Coleman necklaces, and I wear them with pride. Please stop by her table, sample her products. Ladies and gentlemen, Katie Coleman.
Our featured speaker is a professor of graduate nursing at Shenandoah University. She received her midwifery education from the Medical University of South Carolina and her PhD from the University of Missouri. She established the first nurse midwifery practice in Kansas City. She co-established and was program director of the Nurse Midwifery Education Program at the University of Kansas and is a charter member of the Kansas Maternal Child Health Coalition. She also works as a consultant to AMOS Health and Hope in Nicaragua. She has been published in numerous scientific journals, including the Journal of Midwifery and Women's Health, the Journal of Perinatal Education, and the Western Journal of Nursing Research. She has co-authored a book and has been interviewed by Oprah and Prevention Magazine. Ginger is the president of the American College of Nurse Midwives and has been instrumental in establishing midwives as leaders in maternity and women's health services. She left the ACOG meeting in DC at 4:30 p.m. today to be here with us tonight. Ladies and gentlemen, I am proud to welcome my friend, to to welcome Ginger Breedlove. Where is she?
Wow, you guys know how to have a party. I can tell you that it's such an honor to be here with you tonight. I am nearing the end of a 3-year term as president of the American College of Nurse Midwives, and I have traveled more miles than you can possibly imagine. But I will say, without a doubt, of all of the venues I have been in, I have never been to an event with this much diversity around advocacy for moms and babies as what you have here tonight. It's so impressive. My mantra as I've been traveling around the country trying to strengthen the partnerships between midwifery and obstetrics. And when I say midwifery, I'm including all midwives when I say midwifery, is that if you're not part of the conversation, then you're part of the problem. And your very presence being here tonight means that you want to be part of the conversation. So I just want to applaud you all for being here and seeing the smiles and the confidence. I started a practice in Kansas City under a microscope with maternal fetal medicine physicians many years ago. And I know when something new happens, you're constantly watched. But I have every confidence this community is behind supporting the midwifery model of care as it integrates into this health system. So you should be very, very proud. I promise you I'm not going to stand and deliver 30 minutes. I know you're all tired and there's a lot going on, but there are some key concepts that I want to share with you that I think are really important. And that's on the heels of being at a day and a half with ACOG in their board meeting, where I've been for the last 3 years trying to bridge the conversations about advancing maternity care in our country as a group. This is so interesting. I have a son who's a music performer, and when you're on stage playing in a jazz venue and everybody's still talking, your brain is sort of schizophrenic, so my apologies here. But anyway, I want to just say a few key concepts to you that I think are really important take-home messages. And one is midwifery is not new. Look in the Bible. I mean, you think about the evolution of how birth has happened over time, as well as the modernization of midwifery. We have been with women really since the beginning of time. And I think in our country, we've been challenged, as was shared just a minute ago, by the medicalization of maternity care that happened sort of from the 30s on and what happened to midwifery after that. But I think what's really important for you to know is that even in the 1930s, when midwives were in the hills of the Appalachian Mountains in Kentucky or in the urban core of New York City, the outcomes of midwifery-led care were equivalent to, and I'm not going to argue surpassed, but they were excellent outcomes. And you cannot show me one midwifery study where outcomes of care have been called into question. So I think it's important for you to know that and appreciate that. Last year, the American College of Nurse Midwives celebrated their 60th anniversary. That's 60 years. And we're very proud of that momentum that has led us really to being more integrated into the American healthcare system. So I want to talk just a little bit about ACOG because it's not either or, as you heard a moment ago. It's both and. Midwives and physicians need one another, because that model of care, if you look in the European countries, has proven to outscore us in almost every health indicator related to how moms and babies are doing. So one of the things that I really want to share with you about the positives of our relationship with ACOG in the last 5 years And I will say that it's primarily been led by Dr. Rich Waldman out of New York when he was the president of ACOG, is embracing a variety of statements that have endorsed and advanced the practice of midwifery, including, if we have any CPMs in this audience, endorsing the CPMs through the ICM standards. I sat in the board conference room in February of 2015 when this action item came before the ACOG board of about 45 obstetricians. When the question came up to discuss CPMs and the ICM standards, there was absolutely no discussion. And the vote happened in less than 60 seconds, and it was unanimous. You have the support of ACOG by CPMs following the guidelines of the ICM global standards for all midwives in all countries around the globe. So you really should celebrate that. In light of that, anyone who's a physician in this audience and many midwives in large practices are aware of the challenges of the current healthcare system. We are bombarded by the environment. There is an incredible workforce crisis in care of women. It's not just obstetrician gynecologists. There are not enough women's health care providers to take care of the increasing number of women who are enrolling in ACA in our country. And it is a significant crisis that will probably have an impact within the next 2 to 3 years. Over 50% of the counties in our nation have no women's health provider. And it's an atrocity and something we have to change. And for me, midwifery is the answer. Partnering with agencies and community groups that have satellite clinics that provide rural health care is an important part of the solution for underserved areas. And ACOG is actually working with us on maternity care provider shortage bills. I had the incredible opportunity, probably one of the highest in my entire 38-year career, to testify in Congress in December before the Senate Energy and Commerce Committee. They didn't ask ACOG to testify, they asked CNM to testify. And it was really a pretty profound opportunity of sharing why this is such a crisis for our healthcare workforce. So you are really exemplary in Richmond of embracing a multidisciplinary team that really can be part of an answer. The other things that are happening is a maldistribution of the workforce. So no matter what profession you may be graduating from, there's a tendency to stay in the city and not to go out to the geographic areas. So incentivizing providers of all types to go into rural America is critically important. Of course, we have the beloved information technology with electronic health records and ICD-10. Something that's moving a lot of physicians into early retirement because of the burden that that brings in terms of the complexity of running a practice and doing what they really want to do. So there are many things that are really impinging on our current healthcare environment, in addition to the fact that maternal mortality in our country is the worst of any developed country in the globe, the worst. So there are many issues we believe contributing to that: systems of care, access to care, overutilization of cesarean section. I could go on, but there are a lot of initiatives developed around how to address that issue. So what are the advantages of collaborative models of care? Well, we know that multidisciplinary team leadership in study after study after study, not just in maternity care, but in all fields of healthcare, lead to an improvement in quality, improvement in safety, reduce cost of care, and increase in access to services. So I would really challenge anyone to show me a study that doesn't prove that interdisciplinary team-based care really is the way to go. The other important issue I think that's so important is integrating scope of practice and reducing barriers to practice. The Institute of Medicine not that long ago talked about embracing practitioners to the highest degree of their education and training And yet we still have many barriers in our country where nurse midwives can't even achieve hospital privileges, or CPMs are not acknowledged in systems of care where they should be. So we have a long ways to go, but I think the window of opportunity is now, if you're willing to stay in this collective and have that conversation. But you can't have a conversation that's difficult, as was shared by the physician a minute ago, unless you're willing to have the difficult conversations that are uncomfortable. This has probably been the largest platform that I've carried with me over the last 3 years. And I will share with you that, to me, a difficult conversation is what advocates change. So if you need help, there are wonderful resources from the Harvard Negotiation Project, a great book called Getting to Yes, and a wonderful TED Talk by William Ury, which is the best 18 minutes you will ever have if you want to have a difficult conversation. And it's called Getting to Yes from No. It is a miraculous explanation of how difficult it is to do that, but the only road to change is your willingness to be part of that conversation. That takes trust, and it takes effective communication. And even though you may feel like you don't know how to do that, you'd be surprised at lunch at ACOG today when some of the doctors came up to me and said, "Why don't the midwives ask us to come to their meetings? Why aren't they willing to talk to us?" And I said, they're probably a little bit intimidated and afraid. Why don't you reach out to them? But my point here is that it's a two-way conversation, like in your family, right? You need to be willing to take your part of ownership in that conversation. So we need to embrace all providers. We need to have data collection that is uniform data indicators so that we can compare data and that we're speaking the same language in the analysis of that. We need to understand transfer of care situations so that no one's put on a stand, but we need to have an opportunity of protected peer review and root cause analysis of any mom in any situation, whether it happens within a hospital system, at a birthing center, or a home birth that requires transfer to the hospital. There are ways to do that if you're willing to do it. I want to highlight some best practices in Virginia. And I just have to call out Amber's unbelievable leadership in such a very short amount of time. I want to shout out to someone you're going to hear in a moment, Whitney Pinger, CNM from GW. And I want to thank Dr. Juliana Fair from the University in Winchester, Shenandoah, who I co-teach with. That's really been a founding midwife in Virginia. So I'm going to close with, I always go to meetings and I'm like, what can I take home out of this? Or am I just going to have a drink and eat and go home? There are two really important documents coming out that I think could be of great value as this model develops. Last year, Dr. John Jennings, the past president of ACOG, on his platform, developed a task force on collaborative practice. Today, he shared that in the Green Journal at the end of this month, the executive summary on this task force will be released. Over 17 organizations have endorsed this collaborative practice book that, to me, is the gatekeeper for how models like Henrico will be replicated across the country. I urge you to look at the Green Journal at the end of the month and to purchase the collaborative practice book when it comes out. The other that I think is as equally important, but is designed by the American College of Nurse Midwives, is our 4th edition of the Administrative Manual for Midwifery, coming out soon this year, an incredible resource for how midwifery can be designed in any setting, rural or urban, teaching or community, and those books can complement one another to help all the partners and all the stakeholders who have to sort of write their approval, right? You can't do this with a pipe dream. You have to have partners in this. It will bring everybody together to realize there are collaborative models that can be emulated and replicated. So Amber and your team, what an honor to be here. I told all the ACOG folks where I was coming tonight. They're quite impressed, and I can't wish you the best on your future journey here in Richmond.
If you live in Richmond and you know what a midwife is, and you know what a doula is, then you're very likely familiar with Keith Bell. You'll be familiar with Keith's work at Oriental Medicine Specialists, and we are happy to count him among our platinum sponsors tonight. Keith has been studying Oriental medicine for over 20 years. He's an expert in Chinese medicine and herbology. Y'all hear me? He's a good dresser. This is the truth. His Instagram tag is Stick It To Me, Dr. B. So if you want to tag him in a picture, that's what it is. Stick It To Me, Dr. B. Keith's work in infertility is renowned. He works closely with our fertility specialists at Henrico Doctors Hospital, but Keith is also involved with the residency program at VCU. He welcomes our newest doctors in his practice to expose them to the full range of holistic medicine. He's an entertainer. He's a wonderful human being. He's my good friend. Ladies and gentlemen, please help me welcome to the stage Keith Bell.
Are y'all ready to have some fun? You ready to have some fun? So I had this long, elaborate speech drawn out to introduce our guest of honors, and I just said, is there anything you want me to say? And she says, keep it short and sweet. So I thought to myself, you know, what can I say about these two ladies that you all haven't read on the internet? Should I tell you something you don't know? Something personal, maybe. And then I realized, you know, Abby Epstein, she's a petite little thing, but she could kick my ass. I know. She's done it. Twice. So, I decided not to go with personal. And I decided not to go with just a regular old bio that you can read online, and I'm going to tell you a little something that I feel about them personally. So, it was Mother Teresa, yes, Mother Teresa, who said, I alone cannot change the world, but I can cast a stone into the water and create ripples. I do believe that all of us here are ripples that were cast from the hands of Abby Epstein and Ricki Lake with the business of being born. I practice and teach holistic medicine, and holistic medicine says that the sum total, we are far greater than the sum total of our individualities added up. This is a birth community celebration. When we bring what we bring to the table, what we're creating here in Richmond, Virginia is far, far greater than what we have individually to offer. Thanks to Amber, thanks to HCA, thanks to many of you here, we're creating something that is far beyond us. And part of the reason we were asked to have Abby Epstein and Ricki Lake here tonight is because many of us in this room believe that we would not be here without their work. We would not be here without the business of being born. Breast milk, Mama Sherpas, Weed the People, Sweetening the Pill. Their work has cast a stone that I believe has affected us individually, it has affected us holistically, it has affected our lifestyle, it has affected a change in society of how medicine will be practiced, and it has affected a future generation. With these babies having a better birth coming into the world now, is going to affect our next generation. I cannot tell you the honor that I've had to work with these two ladies over the last 2 years. I've got to see their passion, I've gotten to see their vision, I've gotten to see their dedication, and I've gotten to see their love. Believe me, you do not become a documentary filmmaker for money. They do this because they believe in what they're doing, and they do this because they believe that the more knowledge we have, the better choices we can make. So, it is my honor to introduce to you Richmond Birth Community, some very, very dear people, Miss Abby Epstein and Miss Ricki Lake.
Good evening, everyone. It's really an honor and a privilege for Abby and I to be here. Honestly, we didn't know what to expect, but Keith Bell, as he said, and that was so beautifully said. Keith, where are you, Keith? There you are. Taking my spot, drinking his wine. We've known you about 2 years, and you met Abby here in Richmond, right? And honestly, when you invited us here to come, we didn't know what Amber Price was up to. We were like, oh yeah, she's a midwife, and oh yeah. We got a tour of the hospital, and we got the story of what she is doing for this community, and we got to see firsthand today in the hospital women that are changed forever because of the gift that Amber gave to them on their day of giving birth. It gives me chills up and down. It brings tears to my eyes, and it tickles us. We are so incredibly moved by the fact that our movie that was very personal, and it was really, we didn't think it would have much of an impact at all. It was just something we needed to put out there in the world. But the fact that it's impacted communities like yours and changing protocols in your hospitals and educating women, it's a profound honor for both of us to be here and to witness it firsthand in your community. What do you want to say?
You finished. You got more to say.
I do, but I'll jump in. Go ahead.
Oh, okay. You're going to jump back. I know you got more to say. Yeah, so as Ricki said, well, first of all, we really want to thank Keith and Josh and Amber and HCA. And I mean, it's really just, honestly, for us, it's a privilege and an honor to come down here. And, you know, it's funny because today when we were walking through the hospital, and I don't know how many times we just cried, and we were just crying over there, hearing the story about Ivy and the surrogate. We're crying, looking at the pictures. It's like, you know, it's hard. Sometimes it's very hard for us to kind of connect to the ripples, as Keith put it, and to remember, you know, what's happening in practice, because we've, you know, moved on in our filmmaking, and now we're talking about cannabis and birth control and all these other things that need to be talked about. So just, it's really, I mean, it's such an honor for us to be able to see firsthand the work that's going on and to meet this amazing community and all these amazing, gorgeous doulas that we took photographs with, and the amazing sponsors and professionals. It's like there's just a tremendous feeling of support and community here, and it's super inspiring. And I would love to say we have this in Manhattan, but we don't. You know, it's very special, I think, what you guys have here. So we're just so honored to be a part of it.
Let me just say that the business of being born, when we set out to make the film, it really, in my mind, I wanted to make the film I'd wished I had access to see before I started family planning. And it's just been really a dream come true that we've been able to create a tool for so many women and men before they start, you know, planning to have their families. It's being taught in colleges and universities all around the country, women's studies classes, gender studies, med school, nursing school. It's just a thrill. So, I mean, for us to see firsthand what it's doing in your community, it just warms our heart. So I want to thank Amber. Amber, you're a rock star. If I ever were to get pregnant and move down to Richmond, in another lifetime, I am coming for you. Yeah, you'll help me get pregnant, Keith? Yeah, I think that ship has sailed. By the way, just so you know, my children, everyone thinks I have babies. My children, I have a freshman in college and a freshman in high school. The baby that is born in my bathtub, he's going to be 15. So this has been very much a labor of love for both of us, and we're just so thrilled to be a part of this evening. Congratulations, Amber, and to your hospital for really taking this next step, this next important step, and being an example for so many other hospitals in this country. They need to be looking at you guys. So thank you for sharing that experience this afternoon. Thank you, everybody, for having us here. I have chills up and down.
Wow. Ricki Lake and Abby Epstein are here, y'all. So we're almost done. Our next speaker and her colleague are featured in the movie we are screening here tonight. She's featured in Mama Sherpas, which will be screened here. She's been a certified nurse midwife since 1986. She's the director of midwifery at George Washington. She received her midwifery education at Yale University. She served on the faculty at Yale, Georgetown, and the Washington Hospital. She's an expert in evidence-based maternity care, natural childbirth, primary cesarean prevention, and VBAC. A recipient of the American College of Nurse Midwives Regional Award of Excellence and the 2010 Women's Health Hero, she's recognized for developing Midwifery Pearls Evidence for Clinical Practice, which received the CNM National Media Award. She was also the recipient of the Outstanding Resident Teacher Award from the residents at Washington Hospital Center. She brings with her Susie Bathgate, maternal fetal medicine specialist, her physician colleague in the practice where she's currently practicing. We're proud to call to the stage Whitney Pinger.
All right, it's really noisy, and I'd like everyone to settle down and be quiet because we have some important things to say. First thing, where are the physicians in the audience? Raise your hand. Raise your hands and step forward because we have something to say to you. How about the nurses? Where are the nurses? Come on forward because we're talking to you. How about the midwives, the nurse midwives who are starting this practice? Come on forward. We stand before you as living proof that an institution can bring on midwives, having never had midwives before, and have unbelievable success for their institution and for their community. In 2007, I started something called the Wisdom Midwifery Pilot Project for normal birth and cesarean prevention. It was so unbelievably successful, it grew out of its original institution, and I had to take it on the road and find a new home. When I approached Dr. Larson at George Washington University, he laughed in my face. What is cesarean prevention? Why would we want to prevent cesarean sections? Well, we all know what's happened in the last 5 to 7 years around cesarean prevention. GW had never had midwives, and we were embraced there because we brought purpose to an institution that needed to embrace the community and to hear what the women wanted. All right? We brought the midwifery pearls, so doctors, get ready. When women are cared for by midwives, they eat and drink in labor. They stay upright and mobile. We use hydrotherapy. We don't give IV fluids, all right? We delay cord clamping. We don't take the mother off the baby for an hour until after the first nursing. These are the things that doctors have had to open their hearts to this type of practice. So now we're in the business of training doctors and practicing side by side with our physician colleagues who practice the same way as we do. And that's an awesome thing. Another thing that midwives do, we don't have timelines in labor. Okay? No timelines in labor. All right? Is it hard? We've gotten used to it. All right? When we practice this way, when midwives practice in a collaborative practice setting with physician colleagues who are their equal and expert partners with different skill sets, we have the very best outcomes that we can offer to women in the world. We have 5% cesarean section rate. 88% of our women deliver naturally without epidurals. I mean, come on. That's amazing. All right? Midwives can't do it alone. We can't do it alone. We have to stand side by side with our physician colleagues. And Susie and I have stood side by side in some of the most dire obstetrical emergency situations and have relied on each other in that situation. So on you go, Henrico. It's going to be awesome.
This is such an amazing event. I'm really very happy to be here. And thanks. I just wanted to say it's really a privilege to be here, especially with my colleague Whitney, with all of the things that she's brought to our institution. As she said, together we've been able to reduce cesareans, we've been able to promote VBAC, we have shared initiatives like a study of promoting vaginal breech deliveries, and so the midwives couldn't do that alone, we couldn't do that alone. It's really a shared practice. Another privilege that we have is exposing our students early to midwifery, so our medical students, our nursing students, our midwifery students. We're exposing them to a shared collaborative practice, and one that we see as the way of the future. So thank you very much for including me.
All right, so in terms of this film, the film was made by a woman who I helped have a VBAC. Okay, at the time I was helping her in labor and taking care of her prenatally. I didn't know she was a filmmaker at American University, but the minute her baby came out and came into her arms, she looked at me in the eye and she said, I am gonna make a movie about this for all the other women who've had cesareans who need to be supported in their vaginal birth after cesarean. And sure enough, Bridget got it done, and Abby is promoting it. You know, these guys, Ricky and Abby, are promoting this movie because women in America have a 30% chance of having a cesarean section. It's an atrocity, and we need to help women have vaginal births after cesarean. So on to the movie.
All right, guys, that's it. Yay. Thank you. Thank you all for coming. This is when the movie screening starts, which is in the Love and Happiness room, down one flight of stairs. So if you're staying for the movie, we ask you to move downstairs. There is an opportunity for questions and answers with the people who are in the movie. They'll be in the room with you tonight. I can't thank you enough, Richmond Birth Community. Thank you for celebrating with us tonight.